Dear viewers, vaginal tightening has become a very current and highly demanded surgery in recent years, especially in women who have given birth naturally, particularly if the baby's birth weight is very high. The vagina's expansion, especially after childbirth, following the recovery period, leads to a significant decrease in the quality of our patients' sexual lives. Therefore, from a sexual perspective particularly, the inability of partners to satisfy each other can lead to very serious issues, even resulting in divorces. I want you to know that this problem can be successfully resolved. Of course, during the examination, we determine to what extent we will narrow it down based on the patient's examination findings by consulting with the patient themselves. We determine how much narrowing to do by asking some specific questions related to their partner or by having them answer some of our special questions. Typically, a vaginal tightening surgery is an operation that lasts approximately 45 minutes and is performed under general anesthesia. We mostly perform the narrowing from the back wall of the vagina, and after narrowing, we close the incision we made in that area aesthetically with self-dissolving stitches. After a vaginal tightening surgery, the patient can even be discharged on the same day. On the same day, you can even go home, and after the surgery, you may experience very light bleeding, similar to the first or last days of your menstrual period. There will be light-colored, leakage-like bleeding in the form of drips. And these will completely disappear on their own within 2 to 3 days. We can overcome this issue even with the use of daily sanitary pads. The most important point here is that the patient needs to practice sexual abstinence for approximately 1 menstrual cycle, that is, 4 weeks or 1 month after the surgery. Sexual abstinence is necessary, especially for the complete healing of the suture line we made in the surgical area. To ensure that the tissues fully integrate and heal, this 1 month sexual abstinence is required. We must adhere strictly and carefully. 1 month later, patients can return to their active sexual life again. And sometimes I even encounter such feedback. Doctor, it wasn't even this good before childbirth. Truly, even better than before childbirth. Results that are functionally better than even before pregnancy can be achieved with these surgeries. And of course, partners with a successful and enjoyable sexual life will also have very happy and successful marriages and children. Therefore, spending an average of 45 minutes on the path to happiness will be sufficient, and we will gladly assist you.